Welcome to College Talk, a podcast brought to you by American campus communities where students love living. Join us for topics including how to prepare your student and mom and dad for college so they can thrive. Now your host, Anthony Rad.
Hello, listeners, and thank you for joining us for the fourth podcast episode of College Talk. I'm your host, Anthony Rad. In today's episode, we're going to explore the topic of mental health on college campuses with experts from University Mental Health Services and Psychiatry and a parent who has navigated the issue with her students. Please welcome our special guest today. Dr. Marla Craig is the Senior Associate Director for Clinical Services of the Counseling and Mental Health Center at the University of Texas at Austin and has been the clinical director for almost 15 years. She is a licensed psychologist and earned her doctorate in counseling psychology at Texas A&M University. She has worked in counseling centers, large and small, for over 19 years now. She previously served as president of the Association for the Coordination of Counseling Center Clinical Services, also known as Clinical Directors Association, which is a great association to share ideas, learn, and collaborate with other university clinical directors, counseling center personnel, administrators, and other university organizations and departments. Our next guest, Dr. Sonya Krishna, is a board-certified physician specializing in child, adolescent, and adult psychiatry and integrative holistic medicine. She completed both her psychiatry residency and her child and adolescent psychiatry fellowship at the UCLA Semel Institute for Neuroscience and Human Behavior. Travis County Medical Society named her the 2017 Ruth M. Bain Young Physician of the Year. She has also earned the highest honors in her field's professional organizations, Fellow of the American Psychiatric Association and Distinguished Fellow of the American Academy of Child and Adolescent Psychiatry. Dr. Krishna started her private practice in 2019 to provide excellent, patient-centered, and collaborative care to children, adults, and families. And our final guest, Anne Valine, is an author whose work focuses on education and social and emotional learning. She is also the parent of two recent college graduates who continue to navigate the tricky terrain of mental wellness while adulting. Thank you all for taking the time to speak with us today, and let's go ahead and get started. So as we are concluding Suicide Prevention Month for September, and approaching World Mental Health Day on October 10th, we have the opportunity to explore how students are readjusting to their new normal through their college experiences and how that might affect their mental health. So Dr. Craig, we're going to go ahead and start with you. Can you give us an update on what you're seeing from students this year and how your university has responded to addressing any changes and how to support mental health on campus at all?
Thank you, Anthony. Great question. So we typically on a college campus would see anxiety and depression is our main presenting concern. So that's no different this past year, year and a half, even including with the pandemic. So anxiety and depression tend to be our number one presenting concerns. Stress also for many of our students, it may not rise to the level of an anxiety or anxiety disorder, so much so as a lot of stress. Also, loneliness is something that we have been seeing an increase over this past year, year and a half, with students feeling disconnected from each other. Also, if they have to go home and feeling, disconnected with friends or being on campus and one of the few remaining on campus, if not all of their friends are here. So loneliness was something that we did see also as an increase. Also saw some increases, and I'm imagining this is also across the board for college campuses across the nation as we look at data and trends and research, eating concerns. We saw an increase in eating concerns for our college student population as well as substance abuse issues and concerns. What we are seeing now that the students are coming back, and here at UT Austin, there's 52,000 that are back on campus. What we are seeing is there's a lot of anxiety about readjusting and transitioning back into classrooms and the worry about being out of classrooms, that traditional classroom experience over the last year and a half. So we are seeing some worries and anxieties around that in addition to looking for possible accommodations, maybe not doing as well as they were hoping. And we're seeing that now as we're approaching already October. So in terms of campus resources, I think you also asked that. So what we're doing on campus is we are providing we have offered telehealth, so we've tried to make mental health services as accessible as possible. So that traditional come to the counseling center, sit, talk with the counselor, we still offer that, but we are doing, and what we had done over the past year and a half with the pandemic is to offer all of our services through telehealth, doing a lot of virtual, whether it's groups, workshops, trainings, our university here, and this is probably happening all across the nation as we are very close with many of our colleagues on different university campuses too. They're doing much of the same, but then also really talking about mental health, knowing and acknowledging that mental health is important and it is having an impact on our students. And it always, has and continues to increase, but this past year has been really, I think, challenging for many of our students. So I think talking about it, providing resources, the university acknowledging it, being something that is present in many of our conversations, and making sure that we're advertising resources for our students.
Thank you, Dr. Craig. Are the students really responding to the face-to-face interaction as opposed to the previous year was more virtual? Are you seeing a difference there?
The students, it's interesting because I think some of our students, many of them still do prefer the telehealth. It's more accessible for them to be able to access their device instead of walking all over to the counseling center here on such a large campus. So we're continuing to provide both, but we are seeing some more traffic. The students are coming to the counseling center a little bit more. We, depending on the counseling center, depending on the clinical space, we are requiring masks still and some physical distancing. So I think that does have an impact on whether students want the face-to-face or they want to continue with the telehealth option. But we are seeing more students coming in and we miss them. So we are excited to see our students in person.
Dr. Krishna, my next question is going to be to you. Is the stigma increasing or decreasing for mental health? And also, what are the concerns and signals for this?
Well, I am happy to report that the stigma regarding mental health struggles is finally starting to decrease. Of course, these topics are still difficult to discuss, but with increased awareness and support, we have seen more students be comfortable in sharing and opening up the doors of communication. In a large study by American Campus Communities and the Hi, How Are You Project, a mental health nonprofit based here in Austin, Texas, 93% of students agree that mental health is important to their overall well-being, and that has actually been in line with what previous year's study results show. So it still is just a huge priority for these students, and I'm really happy to report that that's allowing them to be more comfortable in seeking services. I think they also, per the study, show that they are very comfortable talking about mental health issues with peers primarily, and then also adults, including parents and support staff at school and teachers. This is essential because 75% of mental health issues do arise before age 24. And so that means that those college years, when their brains are changing and they're setting forward on their new independent path, is a high-risk time for these disorders coming up. And so it's a great time to prevent and or intervene. Thank you,
Dr. Krishna. Ms. Valine, any other note to add to Dr. Krishna's thoughts?
Yeah, I would like to add on the topic of stigma that, from a parent perspective, stigma starts at home. And reducing that stigma also starts at home. So as Dr. Craig mentioned, the more you can make mental health a topic of your ordinary conversation with your child and in your home, the more they will feel comfortable addressing those challenges and seeking the help that they need.
And Ms. Valine, as a parent caregiver yourself, obviously parents and caregivers may feel such a disconnection or powerlessness when their student has left home for the first time. I'm sure a lot of parents and caregivers can relate to that. How can they be present and proactive while still being long distance?
Present and proactive, those are the key words there. And I want to address the second one first, really. In terms of being proactive, I think it's super important to make a plan with your child before he or she goes to college. And that plan should include not just where do you purchase extra long sheets and how do you put points on your dining card, but also who are you going to call? So if you're struggling with your mental health issues, sit down with your child and make a list of names and phone numbers that include the Disability Services Office. How do you make an appointment at the health center? How can you use those telehealth options for counseling so that kids know those things? And the other part of that plan that I think is really important is what kinds of forms do they need to sign so that you as a parent can be in the loop in the conversations with their providers. That's something that you don't want to be needing to do when a crisis arises. Do it in advance, find out what the laws and regulations are around FERPA and HIPAA and confidentiality, and get those that information flow arranged before you're actually on campus.
What a great idea, especially the information normally a student won't typically think about, but it's always good to have in advance. You want to hopefully have it and not need it, than need it and not have it. So thank you for sharing that. Dr. Craig, my next question is going to be towards you. What sort of tools or resources are there out there for these parents and caregivers to help support these students?
Well, and Ms. Celine, thank you for saying much of what you said, having the conversations with your student before they get to campus, even setting up prior to, if there has been mental health concerns early on. Sometimes it starts elementary, middle school, depression, anxiety, and maybe they are seeing a counselor. So how to, before arriving to their campus, maybe even have some of those resources in place before they even get to campus, which would be really, really great. On our campus, and I know this exists for many of the campuses across the nation, there is, I think, a real important step for parents is a parent orientation. So right when the students are starting, it's usually in the fall semester, freshmen, or they might be transfer students, there is a parent orientation that usually provides a lot of information for our parents about resources on our campus. And on the campuses, you mentioned the disability office, Ms. Celine, that is absolutely one, the counseling center, knowing just the different resources that are on campus. Many times when the students are going through orientation, they're freshmen, they're not really paying attention to all of the presentations that we're giving about the resources on campus. That's not really where their mind is. They might be thinking about who's their roommate, what's their class schedule, how are they going. I mean, that's it's a different, and they're being overloaded with so much information. So when parents are able to attend, ask questions, gather some information that they're needing, and knowing who to call and what that could look like when their students needing it, and hopefully prior to a crisis situation, we want people to have the tools that they need. So parent orientation is a big one for us. We also on this campus, and I know this exists on many campuses, have a Texas Parents Association. So parents can join this association and really have conversations with each other, conversations with the leaders of that association who can help them and connect them to different organizations on campus and departments on campus that might be needed when it's necessary, or just they'll know it in conversation and remember it when they're actually needing it. So those are some of what we do. We also encourage our parents to look at websites, find out about, as we talked about, if there have been any mental health concerns, but also having those conversations early on, saying, well, it can be very normal to feel anxious. It can be very normal for our students to feel sad and depressed and disconnected. That is just part of being a college student, and normalizing that and validating and having those conversations ongoing, not just when it's very apparent, but just checking in with the student. And I say, just like Ms. Celine was talking about knowing the research, go to a website. Look at all the offerings that we have on a website, on a counseling center, or other resources on campus. So that it's just very knowledgeable. Ask questions. Parents are more than welcome to call. There are forms to sign. Sometimes when a student in our state is over 18, they're considered an adult, so we can't really release mental health or health information without the student's written and verbal consent. But a parent can give information, ask questions. I know in my role, I'm definitely answering a lot of questions and talking to a lot of parents about things that hopefully are helpful to them as they're needing information about resources or other.
Well, and it's very good to hear that parents are still reaching out to ask those questions. They feel comfortable to do that. And there's resources and tools out there. These past couple years, I think we've seen a huge influx in technology. Everyone does have their different platforms that they use. So Dr. Krishna, my question to you, as more and more students are reaching out for these services, are you seeing any trends in technology at all on your end? And, with that technology versus the classroom setting, what is the challenge of readjusting for these students?
So I am definitely seeing many trends in technology. Mostly I see that a lot of students just feel comfortable sharing things about themselves via social media. And so I think it's starting at a more organic level with the student themselves feeling more comfortable. They'll show their closets, they'll show their car, they'll talk about their friends and all their activities. And so mental health is part of that too. I feel like we're shifting a little bit away in a great direction towards not just posting like edited photos, but actually the real situations of what's going on. So positive and negative experiences that they're going through, and then they're getting feedback directly from people that they know and people that they don't, the broader community. In this same American Campus Communities and Hi, How Are You study, which is very large with over 10,000 plus respondents thus far, social media was actually very beneficial for 1/3 of the students, and neutral to no impact for another third of the students. So people are really finding support, and the majority of students are using it. I also find that technology has provided increased accessibility, as we've talked about. So a lot of providers have been telehealth in this past year and a half, and that has allowed a lot more flexibility and accessibility. People don't have to drive, especially college students may not have a car. They don't have to schedule in time. It's more flexible. They can just pull up their phone and do it wherever they are. Also now with reimbursement, it has been covered more by insurance, and so that allows them to use their school plan or their parent's plan to be able to get more help. I think this generation is much more used to screens, and so they actually feel pretty comfortable talking and opening up on these platforms. So I think it has allowed for a lot more engagement. I also feel that there are a lot of apps now. As mental health stigma has decreased, there has been a lot more promotion of recognizing that there is a need for such services. And so apps have been created, some much more broad and general, focusing on just wellness or meditation. Other ones are more guided in therapeutic models. And so that can be a good resource as well. In terms of readjusting, I think students really did miss socialization. That they clearly said it on the study, and we would all know that to be true. And they struggled with virtual learning. I think universities did the best they could by making classes available virtually, but it's just so hard. You're sitting by yourself. You don't have that group dynamic. It's a lot more self-paced and independent. And so the students are very excited to be back in person. And the stress levels are actually significantly down than last year. We did this study last year, and as expected, stress was very high. Probably 85% of them said that they were very stressed. And they are still stressed, and there is still a lot of readjusting to do, but the rates are down by at least 25%. So I think that that's significant, that they're ready to get back into it, and they feel more comfortable to do so.
Dr. Craig, any additional thoughts about technology and what you're seeing on campus yourself?
I'll definitely agree with Dr. Krishna. They are using that technology. That's what they, when I talk to parents about go to the website, because our students may not go to a website. They're going on apps and they're on their phones and everything else, and definitely social media. And we use social media. We try to connect with our students through social media as well. We'll have a Facebook page or Twitter, knowing that that's how they're accessing information. So if we need to get out information about services and resources, absolutely. We're also even trying to be, how do we keep up with our students? There's a lot of texting and chatting, and how do we kind of then, kind of pivot our services so that we can also reach their needs. So we're always trying to think about innovative ways that our students, because technology is definitely only going to continue, at least it seems like it, to be the primary way that our students are either connecting with each other or resources. So, but I love that we were able to do telehealth. I mean, we were able to expand on that and provide accessibility and quickly. And that was a big ask for, we have over 60 counselors here at the counseling center. So to ask everyone to get certified and trained to do this within 2 weeks was quite the ask, but we did it because we knew our students were going to need us. And we knew that they were no longer on campus to be able to come into our doors. So I think technology is super important and definitely going to continue.
And Ms. Feline, would you mind kind of adding your 2 cents about, as a parent and utilizing technology with your students when they were in college or even outside of college now?
Well, I think technology is definitely your friend as a parent. Our children are technology natives, and we can use that, to our advantage in terms of being present in their lives, even though we're far away. Both of my children went to school out of state, and now they are graduate students, and both in distant states. We have a weekly family game night, and we do play games together, and that's really fun, but it really also is an opportunity for us just to check in with each other, and for me to see their faces on Zoom and, notice how many dirty dishes are in the background and what kind of lighting they've got in their space, and just, to kind of get a check on what their mood is and how they're living their lives. And I think that can be a huge opportunity for parents to get a little window into their children's mental health and just how they're doing in their ordinary life. And the other thing I think about technology, text is your friend. A text thread can really be a lifeline for a student. I remember my daughter, when she was in college, texting me one evening in the middle of a panic attack. And she texted to me. She was studying for a test she was feeling very intimidated about. She was in a campus building by herself, kind of remote, and she felt that she couldn't even get on the phone and talk to me in person. She was scared about where she was and about leaving the building. And we spent about 40 minutes just on a text thread, reassuring her, talking to her about her breath and moderating her anxiety level. And through that text dialogue back and forth, she was able to get to a place where she could walk back to her dorm room and talk to her resident advisor and make an appointment at the counseling center for the next day. And I really felt in that moment that text conversation, which was, a thread that previous to that had just been funny cat videos and emojis and memes, was a lifeline for us in that moment. So staying present with your child through technology is a way to let them know that you're there and you see them and you care.
As a parent, what advice do you have for other parents and caregivers navigating the mental health landscape on college campuses? And how do we empower parents who support students in the way that is most helpful for their personal growth?
Well, I think the most important thing is to keep in mind that it's about their personal growth. And the most important thing you can do is empower your child to access and use the resources that are available to them. So give them the tools and shore up their confidence in reaching out for help, the help that they might need themselves. And, little lessons, like really, I think college is about learning how to make a friend, how to be a friend, how to belong to the community that you're in. So asking questions about what are they eating and who are their friends and what kinds of activities are they involved in, what kind of exercise they're getting, in addition to the academics, right? We tend to, as parents, stay focused on the academics and how is class going, but for students, the universe of the university is much bigger than that. And I think we need to be asking about their social well-being as much as we are their academic well-being. And I think the other thing that you can do as a parent when a crisis does arise is, as Dr. Craig said at the beginning, know that you can provide information to the providers on campus, even if they can't give you information because of the confidentiality. I would tell one more story, which is that when my son was home for Thanksgiving break in his senior year of college, on the Friday after Thanksgiving, his cousin, who was just a few years older than him, took his own life. It was a tragic event for our family and was really overwhelming for him. And as a parent, I was really concerned about him going back to campus all the way across the country to finish his classes and take his exams. And he insisted on going back and did return to college. And it felt important to me in that moment to reach out again to his resident advisor and just apprise him of the situation and know that there was someone on the ground right there in his dorm who could kind of keep an eye on him and know, what else was going on in sort of the background of his life. And that was really important for us as a family to know that he had that support on campus during that time. For parents, we can get really hyper-focused on college as a 4-year event. But I think, especially now that my children have made it through college and into graduate school and have had work experiences as well. And all of those are places where, mental health has been a challenge for them. That doesn't stop just because you get to graduation. So I think it's important for parents to remember that this is really a marathon and to pace yourself for the long haul. Along the way, be sure to celebrate those small wins and take every opportunity to stay connected with your child, to, notice and celebrate when they're meeting with professors or, getting lots of exercise, making new friends, joining activities. Those are the kind of ordinary life experiences and skills that will build their endurance for the marathon of what they call adulting. It's hard work.
I think you said it best. It is truly a long haul, of adulting, as you mentioned, and it doesn't stop after graduation. They're still, growing and developing and becoming, into their own. So I think you definitely said it best with that. We're going to go ahead and, before we kind of wrap things up here with our panel, I like to kind of go around and get everyone's closing thoughts on student mental health. And Dr. Krishna, I believe we're going to start with you. Any closing thoughts for our listeners out there about mental health for our students?
Yeah, sure. So I think the biggest thing that we can understand is that this is a huge transition time. It's a huge transition time because often kids are leaving the house, they've turned 18, they're adults, they have a lot more responsibility and ownership and autonomy. It's also the biggest time of brain growth change. We thought it was only when they were young, and now we're realizing that the brain continues to really significantly change until age 25. And you start really understanding long-term consequences of your decisions in your late teens up to age 21. And so this is a time that everything is happening. It's a huge change time for a student, and it's a huge change time for a parent. And so this is when mental health symptoms can arise, just based on biology, and now you've added all of these environmental issues as well. So I think that you can help your child as a parent by talking to them openly and regularly, like we've said, without any judgment, and helping them navigate all the aspects of their life, physical, social, spiritual, at their new environment. You know your child the best, and so you need to be able to kind of stay in their lives and watch them for changes in any behavior, mood, anxiety, both for the positive as they grow and develop and are proud of their independence, and also in case it does turn into something that may be more concerning, so you can intervene early.
Ms. Valine, do you mind sharing some closing thoughts with our listeners?
Yeah, I think that it really comes back to what you said at the beginning about being proactive and being present. Having that conversation with your students over time, not overnight. This is not a one-time thing, and continually letting them know, I'm here, I believe you, I won't judge you, and I'm going to support you. And supporting you means providing accurate information, pointing them toward all those resources that are available on campus, and most importantly, being compassionate and empathetic to what your child is going through, and just continuing to be there no matter what, and to let them know that you're there to support and connect and be a part of their broader community on the campus, so that you're really recognizing not just your student, but that the success for them means being connected to their friends and professors and all of the folks that they're meeting in that broader world on campus.
And Dr. Craig, any final thoughts for our listeners?
Well, I think Dr. Krishna and Ms. Valine have said things perfectly. I really do. I was trying to think, wow, those are, a lot of the highlights. And I'm so glad that we're here today, being able to talk to our parents. And I really don't have anything to add other than just emphasizing the importance of communication, that it is not just about the classroom and the academics. It's broader than that for students, and that there are resources. And then also keeping in mind, knowing the resources, but knowing that maybe the counseling center can't do everything. They're not going to have all the resources there's going to be limitations on what we can provide. So knowing the resources prior to going to whatever living situation that their student's going to be in, and knowing the city's resources, the town's resources as well, is also really important.
Well, we really appreciate all of you taking the time to speak with us today, and hopefully our listeners have some new perspectives and tools regarding mental health to help them have a very successful start to the school year. And we want to wish you all the very best. Thank you for listening.